A DNA link between diabetes and obesity. There is no known reason for what causes diabetes. There are certain risk factors that make the likelihood of you being diagnosed with the disease higher. One of the only risk factors that you have control over is your weight. If you are obese, the single best thing you can do for your health and the prevention of diabetes is to lose weight. Even in small increments, when you shed pounds you are increasing your health benefits. These may be easier said than done. There are new studies that are now showing that there is a genetic factor or mutation for people who are obese and have diabetes. This genetic malfunction affects how the bodies use energy and insulin, two key elements in the functioning of your body and the cause of diabetes and obesity. The studies also state that this is not a cause and effect case. If you carry this defective gene, you are not guaranteed to be obese or have diabetes. But the link is there and it can be prevented. You may have to work harder at it than others to maintain healthy body weight and put off diabetes, but it can be done. Discuss with your doctor options and ways to prevent or put off the onset of diabetes. The gene that researchers have discovered as a precursor to diabetes has been found in young children. It is scary to know that children in their preschool years are being diagnosed with obesity and type 2 diabetes due to genetics. But parents can reduce or prevent these things from happening by giving their children healthy lifestyle choices. Now that a DNA link has been found, the research can focus on finding a way to fix or prevent this from happening at some point in the future. While talking about diabetes, you may be frightened of the idea that you may have it. Or maybe, you may have it in the future. You want to know if you are at risk to develop diabetes, and anxiously you're looking to find if you have any diabetes symptoms. Diabetes affects the manner in which the body handles carbohydrates, fats, and proteins. If neglected, diabetes can have serious complications. Diabetic people have a high blood sugar level. The blood sugar level is regulated by insulin, a hormone produced by the pancreas, which depends on your eating habits. Diabetes is a serious disease. But the startling truth is that diabetes is reversible. Diabetes is the #1 cause of chronic kidney disease (CKD). This disease is a condition where the body is unable to automatically regulate blood glucose levels, resulting in too much glucose, a sugar, in the blood. Diabetes is a chronic disease that affects as many as 16 million Americans. Actually, there is no clear symptom of diabetes. The most common symptoms of diabetes are as follow: being all the time thirsty, frequent urination, increased hunger, feeling all the time tired, having excessive fatigue. On the other hand, there are some other symptoms of diabetes that are prescribed as diabetes complications in fact. These symptoms are vision changes, recurrent skin infections very difficult to heal, tingling or numbness you may feel in your extremities, gums disorders, hair loss and many others. There are two different types of diabetes. Type 1 diabetes, juvenile diabetes or insulin-dependent diabetes. The reason for type 1 diabetes is due to pancreas inability to produce insulin. Type 2 diabetes, non-insulin dependent diabetes or adult-onset diabetes. This diabetes is a result of body tissues becoming resistant to insulin. It is usually hereditary. Type 2 diabetes is more common than type 1 diabetes. Type 2 diabetes is a lifelong disease marked by high levels of sugar in the blood. Conditions associated with type 2 diabetes include hyperglycemia and hypoglycemia. Type 2 diabetes may account for about 90% to 95% of all diagnosed cases of diabetes. Up to 2/3 of people with type 2 diabetes have no symptoms. Obesity is the single most important risk factor for type 2 diabetes. An estimated 20% of all cases of new-onset type 2 diabetes are in individuals between the ages of 9 to 19. The more you know about type 2 diabetes, the more you'll be able to take the right steps to take control of your condition. If neglected, diabetes can lead to various complications such as damage to the kidneys, heart disease, nerve damage, hypoglycemia, drastic reduction in glucose levels. Diabetes is a serious disease and there is no treatment of it. However, it can be brought under control by a proper diabetic diet.